My name is Tamara Persing. I'm the Vice President of Patient Care Services and Chief Nursing Officer at Evangelical Community Hospital. Today I'm going to be addressing with you some of the concerns that the community has brought to our attention regarding fear and uncertainty about the hospital safety during COVID-19. First and foremost, I want you to realize that Evangelical is putting your safety first. I've been an infection control professional for over 20 years in addition to my other credentials. And I can assure the members of the community that every precaution is being taken to make sure safety is first and foremost. As all things have remained uncertain in all aspects of life during this pandemic crisis, what hasn't changed is the compassion and high quality care and putting your safety first that our staff delivers to each and every patient. We want you to continue to care for yourself and do not delay your care. We want to make sure that you receive prompt health care even in the midst of a pandemic, which is vitally important. If you put off your care, you're jeopardizing your health even further, and we do have the ability to provide you safe, competent, high-quality care during this pandemic. Some of the things that we have done to ensure this are as follows. We're screening all patients and employees as they enter the buildings of all of our practices and the hospital proper, including our ambulatory surgery center and our endoscopy center. We have separate testing areas for suspected or confirmed COVID-19 patients. Everyone is required to wear a mask. We've configured our waiting rooms in our hospital, our emergency department, and our patient care offices to make sure that we allow social distancing and physical separation during this pandemic. We regularly disinfect high-touch surfaces. And we're still restricting visitors. I'd like to talk about that a little bit for a minute. I know it's difficult and anxiety producing to bring a loved one to the hospital and have them be here and not be able to be in the room with them when they're being examined or they're being cared for. This is where my nursing team and all members of Evangelical's team excels. We provide the compassionate care and we make sure that we are attuned to those physical, psychological, and emotional stressors during the pandemic crisis. We want to make sure that you're cared for not only physically, but spiritually and emotionally during your hospitalization and during your care in the hospital. We've made important facility and operational changes to make sure that confirmed or suspected COVID-19 patients are cared for separately. We have added negative pressure rooms through our engineering department to make sure that we are able to have a room that as the air is being cleansed at a rapid rate and the virus and the air is being circulated out into the atmosphere so it's not a danger to anyone else. Our operating rooms have been designated for those patients that are suspected of the disease and are thoroughly disinfected with the strongest agents possible between each of the cases. We have also made sure that our ambulances have been thoroughly disinfected in addition to the routine cleaning that they get between each and every patient. And we have a special misting machine that actually cleanses the equipment, and we're also utilizing the same type of equipment in our patient rooms in the emergency department and patient care areas. All patients who are admitted are given a rapid COVID-19 test within 1 hour return time. So we're fully aware of their status and we know that we could treat them appropriately and they're designated to the proper area for treatment. We want to assure you all that your safety remains our highest priority, and we are here to help serve our community to make sure that our patients, our providers, our staff, and our community remain safe. Thank you.